Good afternoon. My name is Yevana Knežević, and I am the Associate Director of the Center for Russian, East European, and Eurasian Studies here at Stanford. And it is my pleasure today to introduce our speaker, Pauline Jones, who is Professor of Political Science and Director of the Digital Islamic Studies curriculum at the University of Michigan. Previously, she served as Director of Michigan's Islamic Studies program, as well as its International Institute. Her past work has contributed broadly to the study of institutional origin, change, and impact, with an empirical focus on the former Soviet Union, primarily the 5 Central Asian states. She is currently engaged in 2 major research projects, one that explores the influence of religion on political attitudes and behavior in Muslim-majority states, with an emphasis on the relationship between religious regulation, religiosity, and political mobilization. And the other focuses on identifying the factors that affect the extent to which people are complying with social distancing policies to combat the COVID-19 pandemic and the impact that these policies are having on individuals and communities around the world. And you will see both of these highlighted in her talk today, which is entitled Trust in Religious Leaders and Voluntary Compliance, Social Distancing During COVID-19 in Central Asia. She is author of numerous articles in several leading academic and policy journals, including the American Political Science Review, Foreign Affairs, Current History, and she is also author of 5 books. Most recently, Islam, Society, and Politics in Central Asia, which came out in 2016, and the Oxford Handbook on Politics in Muslim Societies. Her research has also been supported by the MacArthur Foundation, the Carnegie Corporation of New York, and the Mellon Foundation. And together with our co-sponsors, the Abbasi Program in Islamic Studies here at Stanford, we are delighted to welcome her today. So Professor Jones will present her talk, at the end of which we will have time for Q&A. So please feel free to click the Q&A icon at the bottom of your screens and to submit your questions. And for the time being, I will pass it to Professor Jones. Thank you so much for joining us.
Thank you so much for the invitation. It really is an honor and a pleasure to be here. I know I've been trying to get to Stanford to present for a couple of years now, and we all know the main reason behind that prevention. In any case, I'm very excited to be here today to present this work in progress, and I look forward to your comments and questions. I want to start by the one advance. Let's see. There we go. I want to start by recognizing that this paper is part of a much bigger collaborative project across the University of Michigan that began weeks after the university shut down in March of 2020 in response to the COVID-19 pandemic. And some of us were just motivated by trying to study international coping and compliance. The short term is sick. Yes, that was purposeful. And it involved core faculty, or it's ongoing, it involves core faculty across the university in multiple schools and departments, as well as graduate students. And one of those graduate students, Anil Menon, is the co-author of the paper on which this presentation is based. My microphone's going in and out, so I just want to make sure if everything's okay and you guys can hear me. Giovanna, is everything okay?
Yes, we can hear you well.
Fantastic, thank you. Okay, so in that larger project, we look at a variety of factors, a variety of drivers that might affect voluntary compliance with pro-social behaviors, specifically health mitigation behaviors in the context of a pandemic. In this paper, Anil and I look at the relationship between trust in religious leaders in particular and compliance with pro-social policies, or policies that are costly to the individual, but socially beneficial. Policies like social distancing, mask wearing, vaccine acceptance. Now, the general literature and our previous work focus primarily on the role of trust in political leaders and medical practitioners in driving these kinds of adoption of health mitigation behaviors, or what I'm calling pro-social policies. And they generally find that there's a positive relationship. As trust increases in political leaders, so too does the adoption of health mitigation behaviors. As trust in medical practitioners increases, so too does the adoption of these health mitigation behaviors. That's the general finding. For the current pandemic, however, there's a mixed finding. And even in our own research, we find that there's actually an inverse relationship in some countries between trust in political leaders and adoption of mitigation behaviors. So the more you trust political leaders, the less likely you are, for example, to adopt mitigation behaviors. We also find that in the general literature, there's very little focus on religious leaders and trust in religious leaders. And so we really wanted to zero in on that relationship. Why religious leaders? Well, we think that they are chronically understudied and yet clearly are important actors. Why do we think they're important actors? I mean, first of all, that's what the research tells us. The existing research suggests that religious leaders wield enormous influence when it comes to many other types of social attitudes, social and political attitudes and behaviors, ranging from whether to use contraception to voting, how to vote, whether to vote, and even engaging in political conflict. So we know from previous research that they do wield enormous influence. We also know that religious leaders in many societies exercise enormous moral authority. And we think that this immense moral authority that they have in certain societies could compel people to adopt pro-social behaviors, to do what's costly to them individually because they're being told by someone they respect morally, or someone they see as a moral authority. And finally, these leaders have direct access to congregants, so they can actually convey a message directly to people about these health mitigation behaviors through sermons or other communal activities, events, celebrations, weddings, funerals, Easter celebration, Easter Mass. And we think that this direct access and this moral authority can be bolstered by trust. When you trust religious leaders, that is, when adherents expect religious leaders to be acting in their interest, which is what I mean by trust, how I'm defining trust, then they're more likely to follow their directives. Religious leaders, moreover, should be particularly important during a crisis, or particularly impactful during a crisis. Why? Well, first of all, because people tend to turn toward faith. Either they're already religious and they become more concerned with religion and their faith, or they're not very religious, but they turn toward faith as a way to try to deal with the threat and uncertainty that they're feeling during a crisis. So research suggests that this is the case. We also know that religious services and celebrations can be super spreader events. They can be very large, people come into close contact. And so if religious leaders can discourage their adherents from attending these services and celebrations, they can help to mitigate the crisis, to lessen the spread of the virus, and therefore to help control the pandemic. So I think there's good reason, we have very good reason, to expect that trust in religious leaders matters, that it should have some influence on voluntary compliance with pro-social policies. And here specifically, again, I'm interested in these health mitigation behaviors. What we don't know, what is harder to know, is whether the influence that religious leaders have is going to be positive or negative. What is the direction of the effect that they're likely to have on the adoption of pro-social behavior? Why do I say this? Well, I think there are two issues here. And they're serious issues because they're issues that I think have impeded theory development so far. The first is that religious leaders have conflicting incentives. Yes, on the one hand, they do want to mitigate the spread of the virus, and we certainly want to minimize that spread among their existing members, the existing members of their congregation. So there's a strong incentive for them to emphasize the community's public health obligations to themselves and to the broader community. But on the other hand, because individuals often turn to religion during times of crisis, the pandemic provides an opportunity both to reassure their existing congregants with religion and to expand their congregation to include those who are newly seeking comfort in religion. So religious leaders have mixed incentives as to whether or not they're going to ask their congregants to comply with state directives, state health directives. So they could either conform, their message could either conform to these state health directives or contradict these state health directives. The second issue is that religious leaders are in most countries, or I should say in many countries, highly decentralized. They're both diverse and highly decentralized. And because of this, we can't expect them to convey a unified message. This is exacerbated by the fact that coordination is very difficult under these circumstances, if not impossible. So again, we don't know ex ante whether or not religious leaders' messages are going to conform to or contradict state directives. We saw this in the case of the United States. We saw some religious leaders encouraging their congregants to stay home from church. We saw others encouraging their congregants to do quite the opposite and come to church and celebrate. And we see this with vaccines as well. So there could be lots of conflicting, let's say, or contradictory messages being given to congregants. Bottom line, we cannot assume either coherence or conformity in the message that religious leaders are delivering. So it's difficult for us to theorize about what the direction of the effect, the likely direction of the effect of religious leaders' influence is going to be on voluntary compliance. So how do we get out of this conundrum? What do we do? I want to emphasize that what I'm really trying to do here is theory build and not so much test. So the first thing that I think needs to be done, the first step in the direction of theory building, is to set boundary conditions. Boundary conditions are really important for theory development because they allow us to limit or to place limits on the types of propositions that can be generated from our theory. We can determine the range of cases to which our theory can be applied. So in that sense, we can develop a more contextual theory. So this is really an effort for contextualized theory building. We can't writ large ex ante make claims or inferences about the direction of effect of trust of religious leaders in voluntary compliance, but we can under certain conditions. I also think that setting boundary conditions helps us to identify mechanisms by looking into the cases that are sort of most likely cases. And that helps us then refine theory, if we can identify the mechanisms whereby this relationship is having an effect. The two boundary conditions that we think are important are that there is a dominant religion and that religion, the authority in that religion is highly centralized. So a dominant religion in which religious authority is centralized. Those are the two boundary conditions we set. And the basic theory, and it is very basic, is when religious authority is vested in a single leader or institution, we can expect not only a more coherent message, we can also expect some alignment with state directives. And this allows us to infer that the influence of trust in religious leaders will have a positive impact. So I have two propositions. The first proposition is that trust in religious leaders will be positively associated with the adoption of pro-social behaviors under these conditions, right? And the second proposition, which is not necessarily related to these conditions, but I can talk about that more in the Q&A if people are interested, is that this association will be limited to the domain of expertise for religious leaders. So it'll be primarily for religious celebrations and rituals and not quotidian practices. This is sort of a genuflection to the general literature that posits this very strong and positive relationship between the influence of trusted political leaders and trusted medical practitioners on these daily kinds of health mitigation behaviors. What we're trying to assess is what impact above and beyond that does trust in religious leaders have, or controlling for that does trust in religious leaders have. And I will show you some analysis down the road. Okay, so cases and method. We need cases that meet these two boundary conditions. We want to investigate trust in religious leaders in countries where there is both a dominant religion and the religious authority of that dominant religion is centralized. We choose Kazakhstan and Kyrgyzstan. I mean, I often get these questions about why do you select these cases? And a snarky response is, that's what I study. I study Central Asia. In this case, these happen to be really excellent countries for studying this question, not just because they are Muslim majority states. They meet our two boundary conditions. They're Muslim majority states. 71% Muslim in Kazakhstan, 87% Muslim in Kyrgyzstan, with a large, or a significant rather, minority population of Orthodox, a little bit larger in Kazakhstan and Kyrgyzstan, but that's their largest minority religion. And they have a centralized religious structure. It is true, it is the case, and many of you out there who are experts on Central Asia know this, that in the 1990s and 2000s, the religious structure in neither country was very centralized. And it also didn't have really a parallel state structure that worked together with the centralized religious structure. That changed in the late 2010s in both countries. And I document this in the paper that I did share with those of you who are in the class. As of the mid to late 2010s, in both countries, the Muftiate had been anointed the sole representative of what was a national Islam, and the Grand Mufti was anointed as the chief spokesperson for the Muftiate. This is the case in both countries, and certainly in the few years leading up to the pandemic was consistent across both cases. In addition, these countries also share several other key similarities. And this is important because these could be confounding factors. These could be alternative explanations. So we want to control for as much as possible, make these are most similar cases. Kazakhstan and Kyrgyzstan instituted very similar social distancing policies. I'm not going to go into too much detail on that in the presentation, but the main, I guess the most important aspect is that they both canceled public celebrations almost immediately after their first case in March of 2020, and they closed mosques. And they kept public celebrations continue to be canceled and mosques continue to be closed through approximately the end of May. They did do a brief reopening, after which there was a huge surge in the COVID-19 cases, and then mosques were again closed in mid-June through the end of July and August. My survey, as I'll explain in a minute, was taken at the height of this what some people call the second wave, which really sort of a peak of a first wave in early July. So again, they both have instituted similar social distancing policies, and they've had the same regime type. Again, there's been divergence. Certainly Kazakhstan and Kyrgyzstan early on in the 1990s were more democratic. Kyrgyzstan continued to be more democratic until most would say mid to late 2000s. Since the late 2010s, they've converged toward the same regime type, which Freedom House Nations in Transit Reports calls a competitive authoritarian regime. So before the pandemic, they have similar regime types. They also, according at least to the most recent World Values Survey, share a high level of trust and a high level or a high degree of religiosity. So just approximately over 50% in each country have high levels of trust in their national government. And when they're asked, how important is religion in your life? 64% in Kazakhstan answer that religion is very or rather important, and 85% in Kyrgyzstan answer that religion is very or rather important. There's a misconception that Kyrgyzstan is a much more religious country, a higher degree of religiosity than Kazakhstan, and it's just it's not borne out by the evidence, for sure, particularly in the last decade or so. In terms of the method, given the constraints of conducting a survey during COVID-19 pandemic, we conducted surveys via phone in Kazakhstan and online in Kyrgyzstan with local firms with which I had luckily worked before. Our sample size was 1,000 in each country, spread across the country, and I'll talk about that in a minute. The sample was collected randomly with quotas for age and gender. The timing of the survey, as I mentioned briefly before, peak of the pandemic, July 2nd through 16, 2020, and it was taken in multiple locations. So the reason for the multiple locations was both to, so it was the largest city in multiple locations, I should make that clear, was both to make sure that we surveyed respondents where the pandemic and the social distance policies were having the biggest impact. So there was a likelihood that the people that were being surveyed were feeling the impact of the pandemic and the social distancing policies. We also wanted to capture the enormous regional diversity in Kyrgyzstan and Kazakhstan. So in Kyrgyzstan, it's sort of a north-south diversity. So we surveyed 500 in the Bishkek area and 500 in Osh. In Kazakhstan, and I include a map because it's bigger and more complicated. And it's an old map, so I apologize for that. It still has the older names. We chose 5 regions, Shymkent in the south, Karaganda in the center to represent sort of the central part of Kazakhstan, Uсть-Kamenogorsk in the east, Atrau in the west, and Pavlodar in the north. So roughly 200 respondents from each of those cities, again, to capture this regional diversity. Okay, and we asked about 2 types of social distancing. So the pro-social behavior, we're operationalizing pro-social behavior in this paper as social distancing. And we asked about 2 types that we could assess both of those propositions that I introduced earlier. Respondents were asked first to what extent they modified their celebrations of 3 religious holidays that occurred during the lockdown between early March and late June. These were Nowruz, Easter, and the holy month of Ramadan. In addition, we asked them about weddings and funerals as important life cycle events, which we know in Central Asia are infused with a great deal of religious meaning. The response options for respondents were not at all, somewhat, or a lot. So to what extent did you modify your celebrations? Not at all, somewhat, or a lot. Respondents were also asked whether they adopted 3 different types of social distancing behaviors that we thought were particularly costly to the individual. These were avoiding social gatherings, avoiding physical contact with friends and family, and avoiding enclosed spaces. And we just created a simple index. It's just additive. 1, 2, 3. You get a score of 3 if you adopted all 3. If you say you adopted all 3. 2 if you say you adopted 2. 1 if you say you adopted 1. And 0 if you adopted none of these behaviors. We also included, of course, the trust variables, not just trust in religious leaders, but medical practitioners as well as politicians. So the dependent variable, if you want to speak in social science terms, is adoption of these social distancing guidelines, the extent to which people change their celebrations and whether or not they engage in these quotidian social distancing. The independent variables are the trust variables, trust in religious leaders, trust in medical practitioners, trust in politicians. And people are asked, how much do you trust the following groups of people? It's a standard question that we ask in survey research. And they were given the options of not at all, not very much, somewhat, and completely. We also included alternative explanations, if you will, possible alternative explanations that have been identified in the literature. These include perceived risk to oneself or to others of being infected with COVID-19. Perceived risk should have a positive relationship with the adoption and mitigation behaviors. Socioeconomic status. This should also have a positive relationship. So the better off you are, the more likely, the more able you are to engage in these mitigation behaviors, these social distancing behaviors, like staying home from work, things like this. Third, we looked at beliefs about whether specific mitigation policies were in place. And this is sort of to capture enforcement, state capacity and enforcement. If people were aware of mitigation policies or think that they were going to be enforced. The 2 that we looked at in particular, because they're the most relevant for our dependent variable, are whether or not people believed that the state was restricting gatherings to people within your immediate household, and whether the state had closed places of worship. And then finally, we include the degree of religiosity as a control. And part of the reason for this is that the general literature, right? I said that there's not much literature on the relationship between trust of religious leaders and mitigation behaviors, but there is some literature on religiosity and mitigation behaviors. And there, the relationship is negative. So the more religious you are, the less likely you are to adopt mitigation behavior. So we wanted to include that as well as a potential driver of social distancing. We use logistic regressions to estimate the association between trust and religious leaders and voluntary compliance with the social distancing guidelines. These multivariate models included all of the aforementioned variables that are the ones here on this slide, as well as your standard demographic variables, age, ethnicity, gender, and region fixed effects. So what do we find? That was a lot to get to the punchline, I know. And this isn't even the punchline. We find support for both propositions, but only in Kazakhstan. So trust in religious leaders is associated with greater voluntary compliance with social distancing in Kazakhstan, but not in Kyrgyzstan. Higher trust in religious leaders is positively associated with greater altering of celebrations, this is what this means, across all religious holidays and rituals in Kazakhstan. That's a significant finding. That's an important finding for Kazakhstan. It's disappointing for Kyrgyzstan, but we'll get to that. We also find support for the second proposition that in Kazakhstan, while we find that trust in religious leaders is positively associated with change in celebrations across all religious holidays and weddings and funerals, it is not significant at all across the adoption of more quotidian forms of social distancing. So that index that I mentioned earlier. All right, the association between trust in religious leaders and avoidance of enclosed spaces did approach conventional levels of significance. And we think that that's because that may have been interpreted as whether or not you're going to mosque. So maybe in that regard, religious leaders had some effect, only at the 10% significance level, but approaching conventional levels of significance. But we see that as sort of some support for our proposition, additional support for our corroboration of our intuition here. Okay, this is, so I've just told you in words what we found. I thought though I would share this coefficient plot for those of you who like to see these things. I think they can be a little distracting, but the idea here is if you think of the reference category, what this is being compared to as no trust, so not at all, you don't trust religious leaders at all, right? As opposed to you trust them somewhat, you trust them to some degree, you trust them somewhat, and you trust them a lot or completely. I think it's somewhat, a lot, and completely, sorry. Then you can see, I think, how striking it is that as the level of trust increases, so too does the degree of, or the association with a change in how you celebrated these religious holidays. And this is just for Navruz is for the entire populations. Weddings and funerals and Ramadan are for the Muslim population, which of course is the majority population in the sample. So what do these mean in real terms? Remember, we ran logistic regressions, so I'm going to report the results in odds ratios, right? This is what this is telling us. For Navruz, the odds that individuals with high levels of trust in religious leaders report altering their celebration are 79% higher compared to individuals who indicate no trust in religious leaders. Remember, I said religious leaders, no trust in religious leaders is a reference category. For Ramadan, the odds that individuals who indicate higher levels of trust in religious leaders report altering their celebration are 93% higher compared to individuals reporting no trust in religious leaders. And finally, for weddings and funerals, which of course don't have a specific date, they could be spread across the few months of the pandemic and the social distancing guidelines. The odds that individuals who indicate high levels of trust in religious leaders report altering their celebrations are 60% higher compared to individuals reporting no trust in religious leaders. So there is something happening here. There's a strong and positive and consistent association between trust in religious leaders and the adoption of social distance behaviors regarding religious celebrations and life cycle rituals in Kazakhstan. But this, while it should be, I guess, somewhat good news if we want to find corroboration for our propositions, it also presents us with a puzzle. Why is trust in religious leader so positively and consistently associated with voluntary compliance in Kazakhstan, but not Kyrgyzstan? Our intuition here is that it's because content matters. So even if religious leaders in both countries are conveying a unified message to their adherents, and this message is consistent with state directives, the content of their message, so what they're actually saying and as opposed to, I guess, how they're saying it, may have differed in ways that could reasonably affect compliance. And we think in particular what might matter is whether or not religious leaders offer clear alternatives to their adherents. How can you celebrate this and still be in compliance, if you will, with your faith? How can you still meet the requirements of your faith and meet the social distancing requirements, and some sort of absolution for doing so? That might be important in the content. So what we did was we went ahead and looked at the content to the best of our ability. We tried to review and compare statements across both countries from the Muftiyyat. So we conducted a systematic review of the Muftiyyat statements concerning all types of social distancing policies in the national news media, and we compared these statements across several dimensions. So for each country, we assigned a positive score if the messages met our criteria and a negative score if they did not. I will show you a table where this is all summarized, but I first want to sort of lay out these dimensions because I think it's important to know what we're comparing, right? Before we even started to look at these news articles, what were we looking for? How are we going to evaluate them and compare them? So we came up with 5 dimensions. The first is timing. When was the initial statement related to social distancing made? And the news articles were assigned a positive score if the initial statement was made prior to or concurrent with the announcement of a government policy. The second one was sequencing. So whether there was sufficient time, this is specific to Ramadan, whether or not there was sufficient time between the initial statement from the Muftiyyat about alternative celebrations or the need to stay home during Ramadan, to not attend iftars, right, the meals that end the fast, for example, whether there's sufficient time for people to make other plans or for them to figure out other ways to celebrate Ramadan, since it is such an important Muslim holiday. And so we came up with at least 1 week. So the countries score positive if there's at least 1 week between the initial statement and the beginning of the holiday. The third dimension we came up with is consistency. So whether the statements are consistent both with government policy, which is a nice sort of test of proof of concept in a sense. So, we're saying that under these conditions, we expect that these messages are going to be coherent and consistent. And then we looked at whether or not they actually are, coherent and consistent. So consistent with government policy was one aspect, and the other was consistent with regard to content over time, which is sort of the coherence aspect. And again, if both attributes are fulfilled, they get a positive score. The fourth dimension that we look at is the fourth and fifth are alternatives and absolution. So this is the part of, we think that the content matters, not just the messenger, but the message itself. And here for alternatives, we look at whether the statements from the Muftiyyat provided some expectation that compliance with social distancing policies would not affect one's standing as a good Muslim. They get a positive if alternatives are provided are clear or specific, and if they are explicitly deemed appropriate within Islam. Absolution goes one step further. So it's not just about compliance will not affect your standing as a good Muslim. It's not about just providing alternatives that are deemed appropriate, but it's about making statements that indicate you as a Muslim will still receive the blessings that you would have under normal circumstances, even though you can't observe the religious holiday in a way that you usually do or that is usually prescribed by Islam. Okay, so again, for each country, we used news articles to evaluate the content of the Muftiyyat's messages across these 5 dimensions, and then they either received a positive or a negative score if they met this criteria. And the results are pretty striking. We tried to use, we can talk more about this in the Q&A, we tried to use news media sources that were the most accessible and available, and that pulled media sources. Of course, sources that were available online, since our samples are in cities. We thought this is a sort of a reasonable move to make. And we find that for both Kazakhstan and Kyrgyzstan, timing, sequencing, and consistency, they both score positively. So it's not about the timing, sequencing, and consistency. That's not what's different. The key difference that we find concerning Muftiyat statements regarding these celebration of religious holidays and rituals is the absence of alternatives and absolution in Kyrgyzstan, and their presence, consistent presence in Kazakhstan in the messaging itself. So what does this lead us? I guess I'll get to that in a minute. So this leads us to think that these alternatives and this absolution, that our hunch was right, that in fact, having these alternatives and this absolution were necessary for Muslims to be able to comply with social distancing policy in a way that was consistent with their faith. That's all I'll say about that for now. We'll come back to it. Now, there are, of course, always are alternative explanations. So this is our explanation. The message matters. It's about the content, specifically these clear alternatives and this absolution. But what about state capacity? Some might argue that no, it's really about the fear of getting caught and the fear of enforcement. And so we know, Pauline, you mentioned all of these similarities between these two countries, but we know that a key difference is the degree of state capacity. That's pretty well documented. Well, I would argue that there's good reasons to be skeptical that state capacity is linked to greater social distancing. First, I think because such directives are generally unpopular. They're not just unpopular in the United States, they're unpopular everywhere. And they're likely to have very negative economic consequences. They had huge negative economic consequences in Central Asia, for sure, at both the individual and the country level. So they're pretty unpopular. And the state has disincentives when it comes to strict enforcement. So regardless of how capacious the state is, it has a disincentive to enforce these directives. Which means the state is often ambivalent about enforcement, regardless of its capacity level. Finally, strict enforcement deprives the government of the ability to shift blame to the population when health directives prove unsuccessful at mitigating the spread of the virus. And this happened in both Kazakhstan and Kyrgyzstan, where political leaders were blaming the population for not complying, and that's why they were having spikes in numbers. So regardless of how capacious the state is, they have, again, disincentives to maybe want to seem to be enforcing these directives. At the same time, there's evidence that suggests that this skepticism is real. The experience of the current pandemic in particular demonstrates that higher levels of state capacity are not correlated with higher degrees of compliance. So again, reasons to be skeptical. We also attempt to control for this. If you remember the slide with the alternative drivers, I mentioned the controls. We asked people about perceived policies in place, whether or not they perceived that the state was restricting access to mosques, for example, or restricting the number of people that could gather, restricting the size of gatherings. Sorry. The second alternative explanation, I think, that is plausible, is that there's greater centralization of religious structure in Kazakhstan and Kyrgyzstan. As I've said before, in both countries, as of the mid to late 2010s, there's a high degree of centralization. There's also no difference in messaging with regard to timing, sequencing, and consistency, which suggests that the centralization, the coherency, and the consistency, or the adherence to social distancing guidelines on the part of the government, the alignment, is not the issue. Finally, one could argue it's about media coverage, right? There are increased restrictions there are more restrictions on the press freedom in Kyrgyzstan than Kazakhstan. I would argue first that in the last few years, restrictions on press freedom have become almost as severe in Kyrgyzstan as they have in Kazakhstan, as Kyrgyzstan has sort of degenerated into a more of an authoritarian or competitive authoritarian regime. And that during COVID, there's lots of documentation that there were increased restrictions on press freedom in both countries. Moreover, if we grant that there was relatively greater press freedom in Kyrgyzstan, then we should have seen more not less coverage of the Muftiyyat statements. And we see more or less equal coverage in Kyrgyzstan and Kazakhstan. So where does this leave us? I think what this leaves us is that we have good reason to, to conclude, it's not the end of the story, it's the beginning, but we have good reason to conclude that the content matters, that alternatives and absolution in particular appear to be primary mechanisms that are driving the relationship between trust and religious leaders and voluntary compliance in Kazakhstan, and I think could be the case in other contexts that meet the boundary conditions that the Kazakhstani case does. Why? Because they lowered the cost, the individual costs of engaging in social distancing. You might ask, how do these alternatives and absolutions lower these individual costs to engage in pro-social behavior? Because that's important. I think that because they gave people religiously grounded justifications for adopting these mitigation behaviors, and thus allowed individuals to reconcile their religious obligations with their civic responsibilities. And I think that's key, and I think that's something that could be applied to broader settings and broader questions. Second, we can conclude that religious leaders, really their greatest impact is likely to be in their domain of expertise, these religious celebrations and holidays. It's interesting that in our media analysis, we didn't just look at social distancing messaging for religious celebrations and rituals. We also looked at for quotidian social distancing. And we found that the same relationship, essentially. In Kazakhstan, they offer clear alternatives and absolution, and not in Kyrgyzstan. But it had no effect in either country. It just didn't seem to matter. Again, there's this possible exception of the avoidance of enclosed spaces. If that's serving as a proxy for going to mosque, then there is some evidence that in Kazakhstan that the messaging from the Muftiyat mattered for quotidian social distancing. But again, it didn't reach statistical significance. And then finally, and this is something I really haven't talked much about, but it's in the paper, we find that it's not unique to Muslim religious leaders. So the Orthodox Church is as highly centralized as Islam is in Central Asia, institutionally. And the statements of the chief Orthodox cleric, of course, is appointed in Moscow in Russia, about Easter also included these clear and specific alternatives that the Muftiyat included in their statements about Ramadan and other Islamic holidays. And you see the same relationship between trust and religious leaders and the adoption of mitigation behaviors for Easter that you do for the Muslim religious holidays. So there's something to this notion of a coherent message that aligns with state directives and includes these clear and specific alternatives. What does this mean more broadly? I think it means simply that the content matters as much as the source. So even where religious leaders, religious authority rather, is highly centralized, the alignment of religious leaders' messaging with the state directives is not enough. It's not sufficient. In order to convince people to comply with health directives, even during a pandemic, religious leaders have to also offer clear substitutes that enable their adherents to practice their faith while complying with social distancing guidelines. So that's the punchline. And I welcome your questions and comments, as I said. Thank you again.
So thank you so much for your presentation. And as Professor Jones said, the floor is open to our attendees. So please do put your questions into the text box, and I will help moderate the questions. Okay, we have our first question. It is actually two questions that are related. And this is from one of our MA students, True Sweetser. And it asks, do you have any insights into how or if the minority Orthodox Christian populations in Kazakhstan and Kyrgyzstan responded to the directives of their own religious leaders? Did Christian leaders in these countries have access to the same media messaging as the muftis? And based on the research, the Metropolitan in Moscow was able to achieve similar results to the muftis, but he is the leader of the dominant faith in Russia. And then the second question is whether, based on your research and expertise on the subject, you can offer any insights into how the faithful respond when religious leaders offer messages that conflict with state messaging.
Great questions, thank you. So in terms of the Orthodox population, roughly 20% in each country, a little bit closer to 20%, a little bit less in Kazakhstan and Kyrgyzstan. As I mentioned toward the end of the talk, in both countries, particularly in Kazakhstan, it's highly centralized, and it's highly centralized because by definition, Orthodoxy and Catholicism are highly centralized religions. So it's less an artifact of the state directives or the state organization of these religions as it is for Islam, right? And Islam is forcibly, in a way, centralized and made to be very hierarchical in Central Asia and many other predominantly Muslim countries. But so we do have Orthodox Christians in our sample, not enough in Kyrgyzstan, but we have a sufficient number in Kazakhstan. We could run analysis on the Orthodox population. I didn't present it I didn't include it in my presentation, but it is in the paper. And we do find that those who higher trust in religious leaders is positively associated with a higher degree of social distancing among Orthodox, just as it is among Muslims. And as I also showed you or mentioned at the end, but I didn't show you, we conducted the same media analysis of the Orthodoxy. And they did have access to the media. Sometimes they made joint statements. Sometimes the Muftiate and the Orthodox Church made joint statements together, and they were always consistent with state directives. So there wasn't any contradiction, and that was something that we expected to happen. So the Orthodox population is behaving very similarly to the Muslim population in Kazakhstan. Unfortunately, we couldn't do the analysis in Kyrgyzstan, so I don't know, because let me sorry, I've been getting over a cold for quite a while. It's so ironic to be talking about health mitigation behaviors, and I'm not following any health mitigation behaviors by staying in bed with my cold. Anyway, so we couldn't do the analysis for Kyrgyzstan, but in Kazakhstan, they're consistent. In terms of what happens when religious leaders give conflicting or messages that conflict state directives, right? This is part of the problem here, is that in most contexts, we don't know, or we can't tell, either because these religious leaders have the conflicting incentives that I mentioned, or because they're highly decentralized. So in the United States, you have religious leaders who are saying, get vaccinated, religious leaders are saying, don't get vaccinated. And the states, meanwhile, the president of the United States is saying, please get vaccinated. It's the only way we're gonna, get through this pandemic, or get back to, quote unquote, normal life. And I think that if people trust, what our research is showing is that trust in religious leaders means that individuals who have high levels of trust in religious leaders are going to listen to those religious leaders, right? And so if religious leaders are telling them, encouraging them to engage in social distancing, and they're providing them clear alternatives, they'll do that. But if they discourage them from engaging in social distancing and don't provide them with clear alternatives, they won't adopt these health mitigation behaviors. And I think that's crucially important, because religious leaders, like I said, they wield enormous influence in this country and in many other countries. So I want to continue my research on this, I guess I'd say.
We've had another question that has come in from another one of our MA students, Grace Kyer, and she references your paper. And she says that you mentioned similarities in the political systems in Kazakhstan and Kyrgyzstan. So how would you expect recent political developments in Kyrgyzstan, namely the high levels of political mobilization after elections in the past year, to impact the levels of trust in religious leaders there in comparison to Kazakhstan?
I mean, that's an interesting question. I wish I could speak to you one-on-one, so I'd like to flesh out a little bit what the premise of the question is. So prior to the pandemic and prior to the October events, trust in religious leaders was quite high. According to our research, trust in religious leaders continued to be quite high. What changed was trust in political leaders. So trust in political leaders was quite high before the pandemic, but according to our research and others, plummeted during the pandemic. And that's not exogenous. That had a lot to do with how the government handled the pandemic, or how the government was perceived to handle the pandemic, and those economic costs that I mentioned, huge economic costs in Kyrgyzstan, also in Kazakhstan. But in Kazakhstan, there was a social safety net to some extent. In Kyrgyzstan, there was less of one. So people lost a lot of confidence in the government, and they did from I haven't done direct research on this, but from what I've seen, they did exactly what the literature predicts, is that in conditions of threat and uncertainty, they turn more to their religion, and they turn more to religious leaders. So I suspect that trust in religious leaders actually increased and didn't decrease, which is another reason I find it so puzzling, or I did find it, now I think I know why, but I found it so puzzling that we were finding this relationship in Kazakhstan and not Kyrgyzstan. Given my priors, I would expect it to be positive and consistent and even stronger in Kyrgyzstan and Kazakhstan. So I think those events may have increased. And you see, if you've been following the events, you saw that the newly elected president ran on a slogan of incorporating religion more in the state, right? Almost an anti-secular kind of message, or at least an anti-secular message from the perspective of the Central Asian countries and the way that they've been approaching the relationship between religion and the state. Great question.
So we have some more time left, and I encourage you to continue submitting your questions. And while we wait for some additional questions to come in, I wanted to ask, if I may, a question myself. And I don't know if this is entirely fair to ask in light of what you're presenting today, but I wonder whether there are other studies of this nature that have been done that look at sort of the differences in states that tend to be more secular, where the populations are more secular. I mean, has any work been done that compares?
That's a really good question too. I have not seen anything. I mean, in general, there's a dearth of literature on this, and I find it so odd because, as I said, we expect these, at least the social science literature tells us that religious leaders have so much influence over, other types of behaviors. I mean, there is some research. I shouldn't say that there isn't any research. I mentioned the research on religiosity. But I haven't seen anything on more secular countries and how that might affect. You've also, I'm sure you've seen that in the context of the current pandemic, there's been a lot of research on really culture, philosophy. So more Confucian countries being more communitarian, and therefore being more willing to adopt pro-social behaviors and engage in social distancing, and then more individualistic society. So the United States, highly religious society. I mean, it's a secular country, but it's a highly religious society, and yet a very individualistic. And so religiosity is not motivating pro-social behavior in the way that it might in another country, a different context. I'm actually headed next month to Thailand to do some research on this in a predominantly Buddhist country, where religion is highly decentralized. So I want to kind of flip this and see, okay, highly decentralized, dominant religion for sure, but highly decentralized context. What was the relationship between, we have some data from this larger project on the relationship between trust and religious leaders and social distancing behaviors, but I sort of want to get at more what the messaging was, and I can't do it from a distance. So I want to kind of, I guess, test this further, but it would violate one of the boundary conditions, which is the centralization. So that's interesting to see.
So we've had another question come in from a visiting scholar here at KRIS, Andrei Kohut, and he asks, did you compare data of your research with data on the general trust in religious institutions and leaders in both of the countries?
I did. I mean, the only data that I had at the time was from the World Value Survey, the most recent wave, which I believe was 2017 to 2019. I can double check that, but it was prior, certainly prior to the pandemic, and it's similar. It's very similar in terms of overall levels of trust in both countries. We now have the Central Asia Barometer, which we didn't have. Grad students, this is exciting. You have survey data, longitudinal survey data. We didn't have this before, and it's very recent, but it's good data. They just, the problem with using somebody else's data is they're not going to necessarily ask the questions that you want to ask. But it's still good data that you can do some work with. And I have to confess that I have not yet looked at Central Asia Barometer to see if they ask about trust in religious leaders, but that would be another place to look. I've only looked at the World Value Survey. I'm biased because I'm at Michigan. We love the World Value Survey. This is.
Okay, I mean, we're coming up at the end of our time. I think we do have time for one more question, if anyone would like to squeeze one in. Give it a second because it takes a moment for the questions to filter in. I see there's one in the chat. Thanking you for all of the insights. And let's see. I think this is asking about how results in Uzbekistan and Tajikistan might be a little different because of the nomadic history of Kazakhstan and Kyrgyzstan, making religious muftis there not as influential.
So I think that's a real misperception. I think that the evidence just doesn't support the perception that either Kazakhstan and Kyrgyzstan are not highly religious societies, or that they're less religious than Uzbekistan and Tajikistan, or that muftis and the muftiyates are not influential. The documentation, both anthropological and otherwise, is that they both underwent really intense revivals, Islamic revivals. I call it Islamic transformation. Other people call it an Islamic revival. That people have really turned to and invested in learning about Islam from a variety of sources. It's made the government nervous because they don't like that people are what's the right word, experimenting to extent with different expressions of their faith. But that's been something that anthropologically especially has been very, very well documented. So they're highly religious societies. The Muftiyat in both countries, even in Kyrgyzstan, has gained trust and respect over time vis-a-vis its relationship with the state, and by virtue of being, as I said in my talk, anointed as the sole representative or sole spokesperson, and because the Muftiyats in these countries develop sequentially to the parallel state apparatus. We all remember, or I shouldn't say we all remember because you guys aren't old enough, many of you, but if you've studied the Soviet system and you've studied religious regulation in the Soviet system, you know that there were these parallel structures, as there were in most of the Soviet Union, the Soviet system. And so you had, the Muftiyat, which is where the idea of the Muftiyat comes from, the Soviet system, which was this quasi-independent religious institution. And then you had KARK, right? You had the religious bureaucracy that was a state institution that operated alongside and really monitored the Muftiyat. In Uzbekistan, in particular, those structures continued to be parallel from the time of independence. From the early 1990s, Uzbekistan maintained that parallel structure of the religious bureaucracy and the state bureaucracy that monitored and worked alongside with the religious bureaucracy. In Kazakhstan and Kyrgyzstan, that was disrupted. And so the Muftiyat came first, and the Muftiyat developed its own level of trust with the community, its own kind of relationship, its own set of actors, independent and separate from the state for the first decade or so, right? Almost 2 decades, decade and a half, sorry, in both countries. until the state sort of came in and really tried to monitor it and impose its own parallel structure. So I think that's a misconception or misperception. If you have evidence that supports that, I'd love for you to share it with me, because I don't see it, or I'm not convinced, let's say. Did I miss, there was a second part of your question about Uzbekistan and Tajikistan. So I don't necessarily think that the Mufti is more, or I don't at all think the Mufti is less influential in Kyrgyzstan and Kazakhstan. Of course, it would be really interesting to look at Uzbekistan and Tajikistan. Problem is I couldn't get the survey into those countries. I've had an enormous difficulty getting any surveys into Uzbekistan and Tajikistan that ask about religion. So I can't ask, but I expect that there would be a very strong relationship in both countries. But again, right, if I'm right, what would matter is the content, not just who's giving the message, but the content of that message. That's also something that's very difficult to get at in those countries because, I mean, the internet is so highly managed in Uzbekistan in contrast to these other countries. It's becoming, more constrained in Kazakhstan and Kyrgyzstan, but it's very highly managed in Uzbekistan at least.
So we've had one more question come in from one of our undergraduate students, Jenna Tedderin, and I think this is a good question for us to end with. Do you think these findings would apply equally to another country that has a centralized religion that is not Islam?
Yes, I do. And that is the beauty of developing boundary conditions, right? The boundary conditions can allow you to have a theory that's very contextualized, but it's not limited to a single case. So even though I'm exploring, if you will, these theoretical propositions in the countries that I know best, and I think that makes a lot of sense, I expect them to be applicable to other countries that meet these boundary conditions. So dominant religion, centralized religious structure. And like I was saying before, I want to also tease that out. Do I have the boundary conditions right? Maybe not. So I would expect this to apply very well to Turkey, for example. And we ran a second wave of the survey in a subset of countries that included, I decided to limit it to Muslim countries just to not introduce too many covariants. But we ran the same survey in Turkey and Indonesia, as well as a Buddhist, Philippines, Thailand, Buddhist, Catholic. So I think it would work in Catholic countries, which are usually highly centralized, right? There's a dominant religion that's highly centralized. But I also think it would work in other predominantly Muslim countries with highly centralized religious structures. And then it shouldn't work so well in Buddhist countries that are very decentralized. But I'm about to see. I'm about to find out.
So on behalf of the center and everyone in attendance today, I'd like to thank you for sharing your research, which is so timely and relevant. And I think we are all very curious to see how it evolves as you continue to add case studies to your work. So thank you very much for joining us today. It's been a pleasure to hear from you about your work.
Thank you so much for inviting me. Appreciate it. Enjoy the rest of your day, everybody.
You too. Bye-bye.
Bye-bye.